Hello, Dr. James Bogash, expert in health longevity, and today we're going to talk about sleep apnea and using a CPAP machine, which for most people really sucks, but so does not getting oxygen to your brain multiple times per hour. So, sleep apnea is definitely a bad thing, linked to all kinds of bad outcomes. It is largely tied in with prediabetes, especially central sleep apnea, but then the weight gain that comes from prediabetes links to obstructive sleep apnea. So really, the big answer is lifestyle changes that will improve your or lower risk of diabetes and therefore increase or improve sleep apnea so that you wouldn't have to use a CPAP machine. But in the meantime, or if somebody's not willing to make lifestyle changes, a CPAP machine is like almost required, I would have to say. But as mentioned, it kind of sucks, and if you're like a side or a stomach sleeper, it can be a little bit more challenging. I know that we've known for a long time there have been studies looking at the didgeridoo, which is an Australian instrument, but it requires circular breathing. It trains the epiglottis to kind of help with sleep apnea, and so people who train the didgeridoo are less likely or can use it can improve their sleep apnea and maybe even reduce the need for having a CPAP machine. And so this particular study, which is a small study, 38 people, followed them for 6 months, and they used a conch shell, which I'd never heard before, but apparently this is a Hindu practice and been around for a long time, but it requires a certain type of breathing to elicit the sound in the conch shell. And yes, we're just talking about the conch shell. If I had one, I'd show you, but we live in the desert, so they're a couple 100,000 or million years buried. So in this study, the people did 15 minutes of conch breathing for 5 times a week, and people with severe sleep apnea were excluded. So different conversation. This is likely mild to moderate, or people who have been diagnosed with sleep apnea, maybe even haven't started on a CPAP machine. So what did they find after 6 months? Well, the daytime sleepiness index dropped by 34%, so that's a good thing. That means they're sleeping deeper and getting more oxygen. And the Apnea-Hypopnea, the AHI index improved in the group using the conch shell. It was 5.6 times, or 5.6 less episodes per hour. So let's say you had 10 episodes per hour, you just cut them in half. Like, it's pretty significant. If you're having 20 episodes, it's a smaller improvement, but it is definitely an improvement. Don't think anybody died in the study, so safety is obviously very high. Cost, and you can travel with the conch shell, so it's not like traveling a CPAP machine. Lots of potential benefits of using this. So the real answer is managing the prediabetes. However, short of that, or in the meantime, maybe grab yourself a didgeridoo or a conch shell and start learning how to blow into it. As always, I'll post a link to this particular study in the description. Make sure you like this video, share it with somebody you think needs the information, and subscribe to the channel.